Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Welcome to the Breast Cancer Podcast. I am Dr. Deepa Halaharvi, breast surgeon, breast cancer survivor, and your host. Joining me today is my co host, Dr. Mark Cripe, program director of breast surgery fellowship. He also does melanoma here in Columbus, Ohio. Today's topic is very near and dear to both of us: the role of exercise in cancer care and survivorship. Dr. Cripe, my partner, is not only a breast surgeon and educator, he's also an accomplished endurance athlete who has completed a number of marathons, triathlons, Ironman races. As surgeons, we both have seen firsthand how movement, fitness, resilience can impact our own lives and the lives of our patients. Today, we have the privilege of speaking with one of the truest pioneers in breast surgery and breast cancer care, Dr. Jay Harness. Welcome. Dr. Harness has dedicated his career to improving the lives of patients with breast cancer. He's a former president of American Society of Breast Surgeons, American Association of Endocrine Surgeons, and Breast Surgery International. Overall course of his career, he established multiple multidisciplinary breast cancer programs across the country, authored more than 100 scientific publications, book chapters, edited several textbooks, has been recognized nationally for his contributions to breast cancer care. He's also the recipient of National Consortium of Breast Centers 2024 Impact Award for his long distinguished contributions to improving the care of breast cancer patients. He's also co-founder and medical director of Breast Cancer Answers, which, by the way, it's an excellent website with social media videos for breast cancer patients, family members, and friends. I will list all these links in my show notes. He's also founder of Cancer Fitness, which is an educational website about nature of exercise oncology. He's founding member and co-chair of International Society of Exercise Oncology. He's a leading advocate for exercise oncology, serves as a CMO of Maple Tree Cancer Alliance. I can just keep going on and on. You're an incredible person, and thank you so much for taking the time to be here, Dr. Harness. Your mission is simple but so powerful to make exercise the standard part of exercise cancer care. Today's conversation focuses on one of the most exciting developments in oncology: how exercise is helping patients not only feel better, but potentially live longer. Dr. Harness, welcome to the Breast Cancer Podcast. It's truly, truly an honor to have you here.
Well, by golly, it's my privilege to be with you, and it's great to see both of you. And you have such a beautiful set where we're recording this, so I'm thrilled to be with you too.
Thank you so much. I appreciate that. I know this has been your passion, Dr. Harness. You've been talking about exercise and cancer long before we were paying attention to it. What got you interested in exercise oncology?
Yeah, a really great question. So it's just about 8 years ago, somebody said to me one day, "Do you know Andrea Leonard?" And I said, "Who? Andrea Leonard?" "Yes, she's the founder of CETI, Cancer Exercise Training Institute." And I said, "Well, what's that? What is that all about?" So as I explored and met Andrea, then I found out that she was a cancer survivor, a personal trainer, and 10 or 15 years earlier had started training programs, particularly with Pilates instructors, personal coaches, and others, to work with cancer patients out in the fitness industry setting. And I was fascinated by all this. And I said, well, gee, where's the science? She said, oh, you're not aware of the science? I said, well, we all know that exercise is good for us, but what science? And then it was like a lightning bolt, you two,
Mm.
because suddenly I stumbled into, at that point, close to 30 years of hardcore clinical trials,
Mm.
started around 1988 by PhD researchers in exercise physiology, kinesiology, even sports medicine.
Mm.
In fact, one of the global leaders in all this is the American College of Sports Medicine, because this is where a lot of this research began. And since the very late 80s up through last year, there have now been slightly over 3,000 prospective clinical trials, resulting in probably around 30,000 publications.
Yeah.
The
Mm.
science is irrefutable. And I
Yeah.
kept saying to people, wait a minute, why am I not? Come on. I'm a
Yeah.
surgical oncologist. Why am I not aware of what's going
Yeah.
on here?
Right.
It's a simple answer.
Yeah.
All these publications have been primarily in their literature with very little crossover to our literature, not only the general medical literature, but certainly to our oncology literature. So as I sort of got more and more involved, I then met some of the leaders here in the United States. Karen Wonders is the founder 15 years ago of Maple Tree Cancer Alliance. Karen has her PhD in exercise physiology and is a professor at Wright State University in Dayton, Ohio. Maple Tree Cancer Alliance is the largest provider in the United States of certified exercise oncology specialists and trainers.
Mm.
These are all bachelor level graduates of, again, kinesiology, exercise physiology, even sports medicine programs that then go through additional certification in order to work with cancer patients.
Mm.
That then led to meeting Catherine Schmitz, known as Katie. And Katie has been at this for 30 years
Wow.
as a PhD researcher and probably globally one of the real true leaders in this whole world and discipline of exercise oncology. And that's how I got involved. And the deeper I got involved in all this, serving as you will as the chief medical officer at Maple Tree, it's more of an advisory role there, particularly with their medical advisory board. I got deeper and deeper into this. And then I said, well, who are the physician spokespeople? And that's why I've founded a little under 2 years ago, cancerfitness.org, as a way of trying to educate our own colleagues,
Yeah.
Yeah.
let alone breast cancer and other cancer patients,
Yeah.
and of course, their caregivers and family members. So that's what Jay is all about. And it's really been an exciting journey.
That's wonderful. And it is so close and near and dear to our heart,
Yeah.
and as we talk about as physicians, what is exercise oncology exactly? If you define that, what do you tell people?
Yeah, I tell them that it's a adjunctive discipline of how we should be approaching the care of cancer patients. And I have to share with you, when I first got into all this, my colleagues, if I would mention to them that I was doing it, oh, come on, Jay,
Hmm.
that's just woo woo.
Hmm.
That's just feeling good stuff.
Wow.
No, 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 there's real science here.
Yeah.
Right.
And then subsequently, a year or two later, as I got more involved, they say, oh, that's a weight reduction program.
Hmm.
No, 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 it's way more than a weight reduction
Hmm.
program. Then people misinterpreted what I was saying, thinking, like Mark here, that I was getting people to train for Ironman contests,
Yeah.
okay? Right? Or 10K races or whatever. And finally, what I've gotten around to explaining, we are talking here about moderate intensity exercise.
Yeah.
Mhm.
Let's define that. And as a matter of fact, there's a national and international criteria and standard for what is moderate intensity exercise. Simplest way to think of it is 5 days a week for 30 minutes walking briskly around the house, outdoors, in a gym, wherever you want to do it, so that hopefully you're getting your heart rate up over 100.
Right.
Okay. 30, that ends up being 150 minutes a week. And what we want to do then is to combine that with 2, maybe 3 days a week of resistance training, whether it's by bands that you can do at home, free weights that you can do at home, going to a fitness center, wherever it may be. The other important caveat here is this is a continuum of care.
Yeah.
It should hopefully start as soon as the diagnosis of any
Yeah.
cancer is made.
Yeah.
Hopefully would include prehabilitation,
Mhm.
literally getting patients ready. In our world of breast cancer, we know that our HER2 new and triple negatives, more likely than not, are going to have neoadjuvant chemotherapy.
Right.
So why not begin the process of getting them ready to start their chemotherapy? Because of all these clinical trials, we know that people receiving chemotherapy do so much better when they're moderately exercising. Okay. So beginning with prehabilitation, clearly during active care, but particularly out into long-term survivorship. And we envision that the prehab and active treatment setting would typically be medical centers, the cancer centers that we're all involved with.
Mhm.
Yeah.
And more likely than not, the long term should be out in the fitness industry. And a good example of that is the Live Strong programs at
Yeah.
the
Right.
YMCA's, which is a fabulous example of that continuum of care. And that continuum is really important.
Yeah. Yeah. Long term. And as I talk to some of my sports medicine colleagues, defining that exercise, just like you mentioned, getting the heart rate up over 100 beats a minute. And many patients will come in and say, well, I walk my dog. And I'm like, okay, but do you stop and pick
Yeah.
up after your dog? Do you talk to the neighbors? Do you smell the flowers? Or do you have sweat running down your brow? So I think that's a good thing to mention to patients. Again, getting your heart rate elevated as long as they're not on a beta blocker. But why do you think exercise matters overall as far as the patient, not just from their cancer or getting kind of ready to take on chemotherapy or maybe even improve their outcomes from surgery? Why else do you think that exercise matters?
Well, there's no question, again, from all these clinical trials, there's an improvement of quality of life.
Yeah.
There's a lowering of anxiety, well documented. We actually know depression is something that we all deal with our patients.
Yeah.
Yeah.
We've known for many years, actually, that one of the best antidepressant medications is exercise.
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 Yeah, for
Yeah.
sure.
Okay. It's also empowering to the patients
Yeah.
Mm.
because here they are in the middle of a marathon of diagnostic tests, treatments, feeling crappy after their chemotherapy, recovering from their surgery, you name whatever it is. And what they're feeling is almost out of control.
Mm.
They're feeling a loss of control, that everybody else is controlling their lives. And with their exercise programs, they're taking control back to themselves. The other thing that's really important here, if we can get patients to be exercising not only with a trainer who they will typically bond with and have a relationship with, but also if it can be done in groups,
Yeah.
Yeah.
because the group setting, there's a bonding that goes on there. So a good example at Maple Tree, pre-pandemic, these were all done on site at the medical center level, either one-on-one personal training or in group settings. And the compliance rate was typically in the low 90%. In other words, once
Um,
people got started,
right.
they kept at it. And not only did they feel better, which is one of the reasons why they kept at it, but was the relationships they were
Mm.
developing
Yeah.
with their trainers and with the others who were involved. Since the pandemic, unfortunately, they had to go virtual. And now at Maple Tree is in about 80 or 90 sites around the United States. Nearly half of them are virtual now. But what we're trying to do is to then urge them to get involved with Live Strong or other community settings where they can continue to bond with other patients. And another thing that we recommend is that they exercise with their partners. So some of the best results are the wife's husband agreeing to exercise with her, walking briskly, weight resistance training, etc. It bonds the marriage, or whoever the other partners are. That's really important to keep people motivated and involved, guys. Okay.
Yeah, that's great.
That's wonderful. So I'm a breast cancer survivor also, as well as breast surgeon. And I always say I exercise like my life depends on it. That's that's the thing I tell my patients. And it truly does, right? Do you agree with that statement?
Absolutely. And Deepa, I didn't know that until today that you were a breast cancer survivor. It's really interesting. Someday we ought to quantify the number of female breast surgeons, or even male for that matter, who are actually cancer survivors, and particularly breast cancer survivors.
Yeah.
So here's a really important message for your audience. We've got now 35 years worth of clinical outcomes. And the biggest one of all was last year at ASCO, the American Society of Clinical Oncology, meeting every June in Chicago, the largest meeting in the world for oncology, was the release of the Challenge clinical trial. And I think we ought to talk about that a couple minutes, okay?
Yes.
And by the way, for your audience, the global leaders in exercise oncology are actually the Australians. In fact, in Australia, I think over 8 years ago, they actually made exercise oncology a standard of adjunctive care. And it's also been funded by their government, which is what we're hoping for here in the United States. Anyway, the Challenge clinical trial was a global study, started 20 years ago by the Aussies, Western Canadians, Scandinavians, and others. It involved stage 2, high-risk stage 2 colon cancer patients, as well as stage 3 colon cancer patients. There were roughly 450 in each group, a control group, of course, which was basically, hey, live a healthy life. Here's a few ideas about that. And then here's the key, the structured exercise group. And I'm going to continue to emphasize structured exercise, okay? And it was 3 years of structured exercise. The first year done on site at the medical center, and the next 2 years closely monitored. And again, the compliance rate in both groups was in the high 80%. And when they presented this at ASCO last year, the median follow-up was almost 8 years. And the numbers that came out of this, I actually watched the live streaming of the presentation of it, those audience will have 10, 12,000 people.
Yeah.
They got a 5-minute standing ovation.
Oh, wow. Okay.
Because the results were so dramatic.
Right.
In the structured exercise group, there was a 37% improved survival and a 28% lower recurrence of either their original cancer, a new cancer, or anything in all-cause mortality. And even though we've had all these clinical trials over this last 35 years, this one is clearly the blockbuster one. The amount of publicity about this nationally and internationally has been amazing. And those of us who have been in this field for the last decades or so see a real shift going on in the United States, moving us faster to actually making this adjunctive care in the United States, guys. So as I said a minute ago, the data is overwhelming. But here's the other caveat. You've got all these incredible clinical outcomes. What in the world is going on at the molecular level in our bodies?
Yeah.
Okay? Something clearly is. And there are 2 areas of focus. One is muscle.
Mm.
Every time we exercise, our muscles are releasing myokines, MYOkines, myo meaning muscle, kines, polypeptides, proteins. These myokines have a variety of functions, not the least of which is anti-inflammatory, not the least of which is to potentially slow the growth of cancer cells in vitro or in culture. Stimulating the cardiovascular system, stimulating the central nervous system, helping improve the gut biome.
Mm-hmm.
All of these factors, which we know are important for survivorship and quality of life. The other system being stimulated every time we moderately exercise is the immune system.
Right.
Oh,
Yeah.
wow.
Because
Yeah.
every time we're exercising, we're kicking out more in the way of killer lymphocytes, other factors that are not only important to fight infections, bacteria, or viruses, but now we're learning how important they are to potentially go after cancer cells. And if the future of cancer treatment is going to be more and more immunotherapy,
Right.
Yeah.
then it makes sense that perhaps what we want to do is to stimulate the
Yeah.
immune system before we give immunotherapy.
Yeah.
So, as simply as I can, that is really the big picture here, guys. And it's very exciting.
And I'm even excited to say, what about preventing cancer? So one thing right now we're
Uh,
talking about, treating cancer, but if we could get more of America doing this earlier and getting off the couch, hopefully we could prevent a number of these cancers as well, which is really exciting to think about.
oh, Mark, spot on to you. Absolutely correct. And that, the estimate is that 40% of cancers are preventable.
Mhm.
The obvious cigarette smoking is one, but no. In fact, one of my favorite TV shows is CBS Sunday Morning, and they were doing a special today on obesity in Japan,
Oh,
Hmm.
wow.
where there is virtually none.
I was
Yeah,
going
right. I
to
was like,
say,
that's
yeah.
not much.
Okay, and it literally goes back to grade school levels where they're teaching kids about the right foods, the right exercise, whatever.
Mhm.
Then they interviewed a CEO of a company of which multiple companies have requirements for their employees about how much exercise they need to do
Wow,
every week.
that's
Oh,
amazing.
And,
wow.
and in fact, one of them, the pass you needed to get into the office, kept track of your exercise. You couldn't get into the office had you not been meeting the company
Oh,
standards
wow.
That's great. That's
for
amazing.
exercise.
That's amazing. Yeah.
And so, what's the real reality here? It's called lifestyle medicine.
Hmm.
Yeah.
And one of the things we're trying to do at our American Society of Breast Surgeons is to start emphasizing more and more lifestyle issues, of which exercise, obesity, body composition,
Yeah.
all of these things are critically important things to be used to not only prevent breast and
Right.
colorectal and other cancers, but certainly for our cancer patients during active treatment. And one of the biggest subjects at the recently held ASCO meeting was actually the role in GLP-1s
Mm.
Yeah.
and not only cancer prevention, but also in long-term survival. So, Mark, you're spot on.
Yeah. The one question I have for both of your surgeons who've taken care of breast cancer patients, I often, once in a while, I'll have a patient who's too super fit. They're working out, lifting weights, but they get diagnosed with cancer. And the question is, why did I get cancer? And I don't know the answer, right? There's so many
Multi-factor,
factors.
yeah.
It's multifactorial. But what I have noticed personally is these patients do really well, whether they're getting chemo,
Yep.
surgery, radiation, taking endocrine therapy. I think they do better. Do you guys agree with that? Have you seen that in your own practice?
Absolutely. One of my favorite patients, just like Mark and yourself, were some who had pre-diagnosis,
Right.
were exercising very extensively. In fact, one of the pieces of data that's come out of all this, if you antecedently were exercising before your diagnosis, out the door, almost no matter the stage of your diagnosis, you've got about an 18% improved survival going out the
Mm.
door
Oh,
by
wow.
that antecedent history. And one of my patients said that she used to run at least 3 to 4 miles the day before she received her adjuvant chemotherapy, and was amazed how well she did, not only quickly recovering from the chemo, but then we also have data, multiple clinical trials that have been done that have shown that patients who are exercising pre-chemo or post-chemo or during active treatment have a better chance of maintaining dose levels that have been recommended for them for their chemotherapy. So it's a total win-win situation for sure.
And they get less fatigue during
Yeah.
radiation therapy. I mean, there's a
Right.
number of
Yep.
benefits. But
Yep.
yeah, just being able to tolerate surgery and the anesthesia, right? There's
Yep.
so many benefits. So
Yeah.
There's another real caveat message that fits with your question, and that is, historically, our patients receiving chemo obviously don't feel well.
right.
Great, go home and recover for a few days, but then get your tush off.
Yeah.
Get your
Right.
tush off the sofa.
Yeah.
Let's get moving here.
Yeah.
But yeah, encouraging exercise here, troops, is really critically important. Okay.
Yeah.
Yeah. I was
But
going to.
the other thing, and I know you've got the paper there, just another quick caveat. Exercise programs should be personalized.
Mm.
Oh, yes.
Okay, very important, because obviously the baseline for everybody is different. At Karen Wonders at Mapletree has more patients than she can count it, that told her they were more afraid of starting the exercise than they were of getting chemotherapy.
Yeah.
And so the baseline for everybody's different.
Yeah.
And
Right.
that's what the trainers do in creating personalized exercise programs based on where the patients are,
Yeah.
Yep.
or no matter what the cancer is.
Yeah.
But then progressively increasing is the key from there. Okay.
Yeah. I was going to show this paper to our audience who are on YouTube, and it's called Structured Exercise After Adjuvant Chemo for Colon Cancer. This is the challenge trial that you mentioned. This was published in New England Journal of Medicine in July of 2025. And so just putting it up here for anyone that wants to look up this trial, as it's such a remarkable trial.
Yeah. And by the way, with that issue, there was an accompanying editorial that also said, okay, oncology, let's get going.
Yeah.
Yeah.
That's awesome.
Good.
So, Dr. Harness, what would your ideal exercise oncology program look like if you were to create one?
Well, as I said a minute ago, actually, I don't create the programs. I work with people trained to do that.
Yeah.
Okay.
Yeah.
But the ideal program is, first of all, create what's the baseline, which is really critically important. Then, depending on where they are in active treatment or long-term survivorship, incrementally increasing the intensity of the program, whether it's walking around for 30 minutes slowly originally, but progressively increasing it so your heart rate is getting up, or whether it's with light resistance bands or light weights, but we want to increase the intensity. We also want to measure and be following body composition. And I think this is as we know, there are two factors going on here
Yeah.
with the loss of body composition. And that is, our treatments cause the loss of muscle, don't they?
Mhm.
In
Oh,
other
yes.
words, the medical term for that is sarcopenia.
Right.
Yeah.
So we are creating with our treatments
Yeah.
sarcopenia.
Right.
We in our centers should be measuring the body compositions and monitoring them not only throughout active treatment, but particularly in the long-term survivorship. Therefore, to either stabilize the loss of muscle, that's where the resistance programs are becoming way more important. We often think, because of heart disease, that the most important exercise we do is aerobic exercise, don't we?
Yes.
Clearly improves our cardiovascular function. But what we can't forget here is the resistance training.
Mhm.
And so the ideal program that we would be creating is both aerobic and resistance training, particularly measuring body composition as we go along the way. and then seeing what patients are capable of doing, hopefully making it fun
Yeah.
Yeah.
so that they
Yeah.
stay connected to what they're doing and don't dread it. Okay, we don't
Yeah.
want them doing that.
Yeah.
And that's why we suggest it in groups or with a partner or
Yeah.
whatever. And
Yeah.
we also know that having an appointment to exercise, you
Yeah.
tend to keep your appointment, don't you?
Right.
Whether
Yes.
it's with a personal trainer, a group, or whoever it may be with.
Yeah.
But it's maintaining muscle mass, maintaining cardiovascular fitness, and turning it into a lifelong journey
Right.
is
Yeah.
another caveat here,
Yes,
guys.
absolutely. Absolutely. I know you mentioned sarcopenia that happens for women in their 30s, even before, and I am diagnosing, unfortunately, women in their 30s now, but that starts to happen for us in our 30s. But then as we go through perimenopause, menopause, your muscle just declines with time, and you're putting women in menopause such a younger year. So I love that you talked about muscle and muscle being an organ of longevity and all the functions it has for men and women, but particularly for women, we tend to lose it much quicker than men do. So,
Yeah, and also bone structure.
yes,
We
Yeah.
want
Yeah.
to absolutely maintain that as well, guys.
yes,
Not only by our adequate diet, but by we know that our resistance training does help maintain bone structure
yeah,
and loss that can go on there as well.
I have a question for you, if I could. Like, as we go to our hospital administrators and we work for a not-for-profit institution, and I understand they're not for profit yet, they make a lot of profit somehow. How do we get programs to see this as valuable and to pay for physical therapist, all these different, what should we do? What can I do tomorrow to go to my leadership to try to get one of these programs started?
Yep. Well, first of all, you are a physician champion. Both of you are, because you get it.
Yeah.
Okay.
yeah.
If you're familiar with, are you familiar with Simon Sinek?
Yes, I know who that
The
is.
book Start
Yeah.
with Why.
Start with why.
Well,
Yeah.
Yeah.
Simon Sinek talks about not only that inner circle, who is the initial why, if you will, but then building around that initial circle, the early adopters. You two are already at that center, but you're also early adopters as far as spreading the word here, okay?
Right.
So people have been saying to me over this last 7, 8 years, well, wait a minute, Jay. If there's so much science here, come on. If we had this much science for a new surgical procedure,
Yeah.
it
Right.
would have been standard of care 10 years or
Right.
more ago.
Right.
What
Yeah.
in the
Yeah.
world is going on
Yeah.
here?
Yeah.
And so, what are the barriers to making this happen, Mark? That's what
Yeah.
you're really asking.
Right.
Okay.
Yeah.
There are two barriers. Number one is the education of our colleagues and the lack of the hardcore science that's out there. Okay.
Mm.
And so that's a part of what Jay's trying to do with cancerfitness.org. And the second biggie, and it's always a biggie, particularly in the United States, is reimbursement.
Right. Yeah.
Okay.
Mhm.
And so the whole issue of reimbursement has been known for some time. I think Karen Wonders first contacted CMS 10 or 15 years ago, or no, 10, excuse me, 10 years so ago, and said, gee, we got this science, what can we do? And CMS said, do the following 5 things and get back to us. So about 2.5 years ago, Karen did exactly that, went to CMS, said, you told me to do the following 5 things, I've done them, now what? And they said, okay. We want you to put in a request for a national coverage determination,
Hmm.
okay, an NCD. And for your audience, CMS is the 800-pound gorilla when it comes to
Yeah.
creating codes, isn't it? And
Yeah.
reimbursement schedules, et cetera. So a coalition was put together that involved the American Cancer Society, the American Society of Clinical Oncology, the American Society of Sports Medicine, and several other groups. And a huge NCD was put together. And in the prior administration was submitted to CMS. And interestingly, CMS said, send us the first draft,
Hmm.
which indicated that they wanted to see something happen. Now, this is in the prior administration. First draft was submitted. CMS had a positive reaction to it, said most of the data is about breast cancer and prostate cancer.
Prostate. Yeah.
And we're going to suggest that at least initially, this would be where we would start off with, and then see how it plays out for the rest of the cancers. Please submit us a second draft, which prior to the inauguration, the Thanksgiving before the inauguration, the second draft was submitted. And near the end of that calendar year, CMS said, we're ready to meet with you. We're going to meet right after the inauguration. Guess what?
It hasn't happened yet. Yeah.
Everything blew up with the Trump administration, okay? It's still an active discussion. And the momentum I think that we're getting from the challenge trial and others, one would think that Robert Kennedy Jr. would be really interested in this, since he's trying to make America better medically and fitness wise and whatever. So all I can say on this subject is stay tuned.
Yeah.
Now, the way to approach your administrators, Mark, this is how Karen has done it over the last 15 years. She goes in and says, we've got all this science. We've got a huge track record. Can we fund a pilot study here at name the institution?
Right.
And then could we also turn to the hospital foundation as a way of funding the pilot study? Okay. Or in other circumstances, Karen will say, I have an outside foundation that would be willing to fund a pilot study here at our institution. And Karen's got a shopping list of who those outside foundations are. But most of the time, the internal foundation will say, oh, okay, great, let's do it. It's typically an initial 12-week, get the results from it. 95% of the time, it's positive, and the foundations or outside say, oh, well, let's fund it another year, and then another year. So philanthropically, that's the way a lot of these 80-plus programs have been started. And then in certain circumstances, the programs are so successful that they're blended into the overhead of the departments at the cancer centers, often radiation oncology, interestingly. Then another way of funding these, Mark, is an important caveat here, is the physical therapists are qualified health providers. They have the codes, particularly for deconditioning and sarcopenia, and they can do the initial assessment and billing and receive revenue, and then either use their own folks to set up a program or hire outside folks that are trained and certified, not only by Karen, but by groups like American College of Sportsmiths and others have certification programs as adjunctive workers, if you will, in the physical therapy department, and do some billing that way as another way of getting things up and going.
That's great.
Most of the limitations for physical therapy departments are they're so heavily booked with orthopedic related issues and others, and space and others. But most of those can be overcome if physician champions like you really beat on the administrators. Now, then they're going to say to you, Mark, what's the return on investment? Okay. And Karen and Katie have publications that show what the return on investment is. And I just put on LinkedIn, I think a week ago, last week, one of the things that came out of the challenge clinical trial, and I could send this manuscript off to you guys. It's the pre-accepted manuscript that actually shows a return on investment, dollar-wise, to the cancer centers.
Oh, wow.
Oh, yeah. And particularly lowering other additional things that have to be done downstream, et cetera. And so more ROI studies are being done as well. And so I think we're going to, and the other thing, by the way, when medical centers have these programs, not only is the patients love it and give them positive feedback, more referrals come to the medical centers because of the programs, and there's greater retention of patients long-term for other related issues outside of their cancer. So for most administrators, if they're willing to listen to all this, it's a win-win situation, Mark. Okay.
No, that's great.
Yeah.
It's a great
Yeah.
point.
So one thing I will ask you, I want to create a trial. So we work in a community hospital setting here. We also have residents. We train a fellow every year. We have medical students. How could I design a trial? I do have funding. I just was named as endowed chair of breast here at Ohio Health is where I work. I do have access to funding. How could I design a trial and what could I do? Are we looking at recurrence, survival, treatment
Yep.
tolerance, quality of life? Like, how would you approach that?
Yeah, I'm going to turn you over to the two experts who do this for a living.
Okay.
They're Katie Schmitz, who is at UPMC, University of Pittsburgh Medical Center. She has clinical trials that also bring in outside locations like yours that you may be able to participate with. That would be one.
Okay.
That'd be
She's
great.
been designing these clinical trials for years and
Okay.
could give you guidance out of that. And the other, right there in Ohio, is Karen Wonders out in Dayton.
Oh, wow. Okay.
Yeah,
Yeah,
perfect.
Karen would absolutely love to work with you guys, help you design a trial. That's her stick as well. Katie is, both of them tend to drink from fire hoses,
Yeah.
but I've given your enthusiasm and who the two of you are, I will personally beat mercifully on both of them to get involved with you.
Oh, that
Okay.
would be amazing.
Wonderful.
Thank you so
Thank you.
much. Yeah, I
Yeah.
would appreciate that. So, in terms of what would you want a patient, a survivor, a surgeon, oncologist, surgical oncologist, healthcare provider, what would be one message that you would want to give? I mean, there's a number
Well,
of messages.
my one message to my colleagues is learn the science.
Yeah.
Learn the science that literally says that exercise is medicine.
Yeah.
Mhm.
Okay, it's real.
Yeah.
And once you learn this science and once you see the results of this science, like the two of you, you will be converted and understand the importance of this. The other key here, I keep spelling all these caveats out to you, but the key here is the physician referrals to these programs.
Mm.
We know that brochure therapy does not work. A key message. If you hand somebody a brochure, 98 times out of 100, they're not going to do it. But they will listen to the physician who says, I'm going to refer you to, and name the program. In long-term survivorship, right there where you guys are in Columbus,
Yeah.
find out how many of your YMCAs have Livestrong programs.
Yeah.
As a good example. And see what you can do to make referrals to them, create a relationship with those programs. Say, hey, here we are. We want to start referring patients to for our survivorship programs. We want to start referring patients to you. Meet who the trainers are there. Karen Wonders through Maple Tree is aligned with Livestrong and is certifying and recertifying all the instructors under what's called Cancer Fit.
Yes.
This is a slightly lower level than during active treatment of the requirements, but the Cancer Fit certification is what the Livestrong program should have there locally. And I would start with that and then start getting feedback from your patients about how they're doing and whatever. The other thing I would recommend locally in Columbus are your various cancer advocacy groups.
Yeah.
And educating them about the importance of all this and the hardcore data and get them helping you advocate for your programs with your hospital administrators.
Great.
Those are all great, great pearls. Thank you so much. And fortunately for us, we also not just talk the talk, but walk the walk. So walk the talk, rather we exercise. So it's easy for us to say, hey, we're doing it after working 12, 14-hour days, whatnot, that you can do it. And I do a lot of social media stuff where I, take a pictures or videos of me exercising just so that people know that even though I'm busy and all that, I'd still take time out of the day. And I think for clinicians, I think that's really important too.
Yep.
Dr. Harness, is there anything else you would like to say before we finish?
No, I want to say what a privilege it is to be connected to the two of you. Number one. Second of all, I want to tell you what a privilege it is to be on this podcast with you. I would love to have a copy of it so we could promote it as well at
Absolutely.
cancerfitness.org. And I want to really maintain our connection with the two of
Yeah.
you. I want the world to know more about not only the two of you, but your advocacy here
Yeah.
and how much you really get this. But
Yeah.
I'm just thrilled to have been with you today.
Yeah. Well, thank you so much.
Thank you.
It's truly been our honor. Dr. Cripe is more behind the scenes kind of a guy, but he's doing a lot and he inspires me. And I'm more like doing the videos on social media and things like that. But he inspires me a lot. And I really appreciate you taking the time to joining us today and sharing your wisdom, your passion, and your years of experience. One of the things that stands out most about your career is what you have done consistently ahead of time. I saw that you had these videos on social media way before social media was a thing. Now all doctors are on social media, I feel like. And you started multidisciplinary cancer programs, which is now a standard of care. Exercise oncology is going to be standard of care. And these conversations remind us is cancer care is more than surgery, chemo, radiation, medications. It's about helping patients live a good quality of life. And like I said before, I exercise like my life depends on it. And I really think today's conversation really shows that it really does. Whether you're newly diagnosed, undergoing treatment, living with metastatic cancer, the message is clear. Start where you are, do what you can, and every step matters. On behalf of Dr. Cripe and myself, thank you, Dr. Harness, for your leadership, your mentorship, your unwavering commitment to improving the lives of cancer patients around the world and us clinicians. To our listeners, thank you for joining us today for another episode of the Breast Cancer Podcast. My Instagram handle is the Breast Cancer Podcast, as well as Dr. D. Hala Harvey. Until next time, stay informed, stay empowered, and remember, movement is medicine. Thank you so much for joining us today. Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvey.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer, this podcast is not intended for complete medical advice, so please talk to your medical professionals.